Welcome to this special Ardenwood Presents webinar on Medicare and supplemental insurance exclusively for California residents. Today's presentation provides new information since our November Medicare webinars. The content is time sensitive and may require that you make changes to your current Medicare coverage. I'm John Mitchell and I serve as Executive Director and CEO of Ardenwood here in San Francisco. And I want to thank you for joining us today. For generations, Ardenwood has been a refuge for Christian Scientists and their families. It's been fondly called a healing house, where there's an expectation of quick and whole healing for anyone who comes for care. It's also a Christian Science Nurses Training Center, and it's a beautiful residence for Christian Scientists who are fully and happily engaged in ageless living. Most of all, Ardenwood is an idea that has evolved seamlessly over many generations, and that will continue to evolve to meet specific needs in ever-changing times. Ardenwood exists because you value a place where you are free to have a healing through the practice and application of Christian Science. Informational and educational webinars like this one on Medicare, estate planning, the Bible, and inspirational topics, our annual meeting, and our Christmas celebration are among the many ways we offer proof of our utility in service to the Christian Science field. You can find a replay of most of our online events on our website, ardenwood.org. And please visit our new website next week. We'll be transitioning to it over this coming weekend. Ardenwood is a 501c3 charitable nonprofit organization. This means it requires income from our patients, residents, and guests, as well as donations from you to meet our operating expenses. You are invaluable to Ardenwood. Your support enables us to offer uninterrupted Christian Science nursing services, something we've been doing since 1930, and inspiring programs. You bring out the best in us. Finally, the content being shared today is only informational and is not intended to be legal advice. And now let me introduce today's presenters, Jim Maher and Lesleah DeFrisco. I understand that a number of you have talked with them since our last Medicare webinar in mid-November. That's great. And please feel free to be in touch with them or Roger Speer with any additional questions. Their contact information will appear on the screen at the very end of this webinar. Also, due to the level of interest in understanding your healthcare options, we are planning a follow-up webinar on long-term care insurance in early March. And note, this was a change from what we had planned for late January. We'll email you with details in early February. Please tell your friends. Now, Jim Maher is a certified senior advisor and a broker consultant specializing in Medicare. He has been helping individuals and companies navigate Medicare since 1989. He is a frequent guest speaker at law firms, CPAs, medical groups, school districts, Rotary clubs, and both large and small companies. Jim is also a certified long-term care insurance strategist. He specializes in helping human resource professionals and their Medicare questions regarding current employees and how Medicare integrates with retirees and COBRA. Jim lives in Lincoln, California, just north of Sacramento, with Teddy, his wife of 34 years, and their spoiled rat terriers. Lesleah DeFrisco serves as Ardenwood's Director of Christian Science Nursing Services. Basically, Lesleah oversees everything related to Christian Science nursing here. And currently, she also heads up our Christian Science Nursing Arts training program. Lesleah graduated from the Mother Church's training program and has been journalisted since 1981. One of Lesleah's responsibilities is to work with Medicare to ensure proper coverage for our patients who choose to use their Medicare benefit. In this regard, she is an unsung hero for her diligence and competence in wading through the intricacies of Medicare. She is joined in this effort by another Ardenwood colleague, Roger Speer, who processes our Medicare and supplemental insurance paperwork. Rogers will join Jim and Lesleah during the Q&A period. Ardenwood is one of just 10 Medicare Part A Christian Science nursing facilities in the United States. The other two in California are Broadview in Los Angeles and Sunland in Encinitas, or in Orange County. Before I turn the program over to Jim and Leslie, let me explain briefly how you can ask questions. If you look at the bottom of your Zoom screen, you'll see an icon that says Q&A. Click on it, and a screen will appear where you can type in a question. Then press Submit, and it will arrive here. We will collect them and save them for the end of the presentation. Based on the number of questions we received at our last seminar, we will extend today's webinar until about 5:30 p.m. or so in order to answer as many as we can. Please join me now in welcoming Jim and Leslie.
Hi, everyone.
Hi, good afternoon. As a longtime Christian Science nurse, I've had the privilege of witnessing many healings, both in Christian Science care facility settings and at home. Christian Science nursing does not include any kind of medical care, but it provides practical and skillful care for individuals who are fully relying on God for healing. Christian Science nurses are not just personal caregivers. We do much more than that. We do much more than assist with bathing, mobility, cleansing and bandaging, and making you comfortable. We are also spiritual witnesses who behold the perfect man, expect quick and whole healing, and take a stand for the ever-present healing power of the Christ. We are part of the healing team, including the patient and the Christian Science practitioner. Over the years, I've seen that many Christian scientists don't even know if they have Medicare or that they can use it at Arden Wood or other Christian Science facilities. So today, Jim, Maher, and I are briefly going to explain Medicare coverage for Christian scientists and how you can afford to receive care in a Christian Science facility like Arden Wood. Jim is also going to talk about a new original Medicare Part A and B coverage plan and a new supplemental insurance opportunity that's available in California and might be of interest to Christian scientists. Take it away, Jim.
Okay, hi, everybody. I'm going to share my screen now, Eddie, I hope. I hope I did this right. Can you see that okay, everybody?
Looks good.
Yes? Good, beautiful, okay. Well, thank you, everybody. It's been a real pleasure learning a lot about the Christian scientists. Leslie's been super great, and Amy and John and everybody and Roger's explaining to me. So I'm not a Christian scientist, but I am a Christian, so I'm here to help, and hopefully that means something. So I've talked to a lot of you already about Medicare, and it's very confusing. I mean, I deal with consultants and brokers who don't even understand it. So it's very difficult. Sometimes based on the people I've talked to, I think some of you were sold programs that thought were going to be really good and helpful for you, and really maybe are not in your best interest. So I'm going to go through some of that today, just some of the basics. And fortunately, I've always heard you always have smarter people on here like Leslie and Roger. So if they need to jump in, I'm looking forward to it. So again, just briefly about myself. I've been doing this is my 32nd year, so I'm a certified senior advisor, which actually means a lot. I know it's easy to just say a certified senior advisor, but I really do. I'm passionate about helping people in the 65 plus age group to understand how to mitigate their healthcare costs and retirement situations that come up. And I'm telling you, Christian scientists are unbelievable. It's a pleasure dealing with you. You're the nicest folks I've ever dealt with. I know you have a lot of concerns. I want to try and help you on that. So I think I actually know, Leslie, I know what a Rinky is now. So I'm proud of that. So I'm learning, but I'm also very certified in long-term care planning and strategies. And we're going to talk about that, I think, like John said, sometime in March, because you want to know all the options and make sure you mitigate any risk that you have. So going forward, today, just a real quick agenda here. I'm going to go over just some of the basics of Medicare again. Part C, which is the HMO type plans that some of you have, and I don't think you want, versus original Medicare and supplemental coverage, and why original Medicare works well for Christian scientists, Medicare enrollment periods and why they really matter, and why we have something that's really important today. We're going to talk about this Medicare. I know we just got out of one Medicare Advantage open enrollment period. We're going into another, so it's very confusing, but I'm here to try and help. And there's a special offer to residents of California. If you're on Medicare in California, you have a Medicare Advantage plan. This is something that we can change within the next couple months. So that's what we're going to talk about today. So again, Medicare is our national health care plan, right? For people 65 and older or under 65 with certain type disabilities. And it's government run insurance, which really means everybody needs to get it. That's how insurance works. And the government gets your attention by saying, listen, if you don't sign up, that's okay, but we're going to fine you. So you don't want that to happen, right? These are the old Medicare cards. And I show that because some people still have them. And you're going to see on there under John Doe, it's got a Medicare claim number, which used to be your Social Security number. You shouldn't have those anymore. So if you're working with a friend, a relative, a mom, a dad, a grandparent, they should all have these new cards from Medicare. They now have an 11-digit encrypted number in there. So you can see under John Smith, that new 11-digit number, that's your Medicare number. So if somebody has the old card, you can't use it anymore. You need to call 1-800-MEDICARE and get the new one. That's super important to have. So we talked briefly about parts of Medicare, and there's 4 parts. It used to be really simple. Back in 1965, when Medicare started, there were just 2 parts, A and B, really simple. A is the hospital side, and B is the medical insurance side. So outside of the Christian Scientist community, a lot of people use medical insurance quite often. And the Part B side would be for office visits, outpatient surgeries, lab work, x-rays, things like that would be all covered under Part B. So then to further confuse things, they said, hey, listen, you've got a couple insurance options. One of them is this Part C thing. And the best way to explain Part C is when you turn on your TV during the open enrollment period, every single commercial out there seemed to be about Medicare, right? You can get this plan for free and have all these benefits, and you got everything and health and vision and dental and you name it, all for free, right? You've heard all those commercials. Well, that's what they are. But what they forget to tell you is they're restrictive. Anything with initials. So if you have a plan, whether it's Humana or Aetna or Blue Cross or Kaiser, if it has initials after like HMO, PPO, anything like that, now you have this plan. And I've talked to quite a few of you, and you have it, you're not sure, but if you're paying very little premium, chances are this is what you have, right? Then we're going to talk about the other insurance option that I think works much better for Christian Scientists. And that's when you have original Medicare plus supplemental coverage. You don't need Part D. Part D is the government says if you don't have it, they're going to fine you. But I understand the Christian Scientist belief in not using medications. So you don't have to purchase it. But if you do later on down the road, right, Lesleah, the government would fine you. So we'll kind of touch base on that. So, and I know I'm going quickly because I thought Q&A at the end is really good because a lot of people ask questions that I didn't think of that and I should have. So the enrollment periods, that's super important. So there's 3 times you can enroll. The first is your initial enrollment period. That's when you turn 65. So let's say my birthday is June 15th of 1956. So that means I am going to turn 65 this year, whether I like it or not. And I have a lot of people that are in denial. It's like, it's not happening to me. Well, if you're born in 1956 this year, you are turning 65. So the government says, listen, you can sign up during your initial enrollment period, which is real simple. They give you a 7-month window. And you know how you can tell? Because about when you turn 64, 64 and a half, you get bombarded with advertisements from every insurance company saying you should sign up with us. We're the greatest. All they care about, really, quite honestly, is you signing up for them. They really don't listen to your personal needs. They're all telling you we've got the best plan out there, period. So the initial enrollment period, you can apply if your birthday is June 15th, the government actually pushes you forward. So your Medicare Part A and B effective date would be June 1 in this example. So you can sign up 3 months prior to that, which would make that March. So anytime in March, I can enroll and sign up my birthday month and 3 months after. So they really give you a 7-month window to do that. The next enrollment period is the special enrollment period, and that's really easy. So if you are a spouse or significant other are still working on an employer's group plan, and you decide to stay on that coverage for a while, you can do that. When you leave that coverage, you create a special enrollment period with Medicare. And the reason those are so important is because there's no fines, right? The government's always looking at fines. If you don't do something on time, they're going to fine you and fine you for this and that. So you really want to know that you have the rights. And as long as you're on a group health plan, you're protected and they can't fine you. Once you come off that and you enroll onto Medicare, you have a certain time frame. The last one, this is bad, okay? This is the general enrollment period. And if you didn't enroll during that first time, or after you come off your group plan, the general enrollment period, that's bad. And I know I've talked to some of you out there and that's happened to you. And people only do that when they don't understand what they need to do. So we're going to talk about the fines here in a minute. So if I miss enrolling when I'm supposed to, the government says, well, listen, now you have to wait until the general enrollment period. And you go, what the heck is that? Well, that's from January 1 to March 31st, which we're in now. So if I was 65 a couple of years ago and I wasn't working, I just decided, you know what? I don't need this Medicare stuff. You know, I listened to one of my neighbors, or my favorite is my brother-in-law told me not to do this. So I didn't do it. Well, guess what? Government says, that's okay. We totally understand, but we're going to fine you because you should have signed up. So this general enrollment period's bad, meaning that if I didn't sign up, I can sign up now between January 1st to March 31st, and my coverage, my Part A and B, would be effective July 1. But here's the bad news. Look down there. You may pay a late enrollment penalty. So if you didn't enroll when you should have, the government says, again, that's okay. But for every 12-month period that you didn't sign up, we're going to charge you 10% of the Part B premium. In this case, it's $14.85 a month every year for the rest of your life. So you don't want to do that, right? It's a lifelong penalty. So you want to avoid that. The Part D penalty, even though a lot of Christian Scientists don't have it. So if you haven't signed up for it and you never sign up for it, there's no penalty. But if you do intend to sign up for it down the road, there would be a penalty, and it's 1%. And you go, yeah, that's not 33 cents, right? That's not a big deal. Well, if you decide to sign up for it eventually, or somebody, one of your neighbors who's not a Christian Scientist, they would pay in 10 years. That's 120 months times 33 cents. That's in the $40 range every month just for a penalty. So you really have to know what you're doing here. You really want to be educated and make an informed decision. So we'll talk just briefly about the 4 parts of Medicare, and Leslie's going to hop in here and help me with this too. So Part A is I always think of it's the accommodation side of Medicare, right? You're going to spend the night somewhere, and the hospital for inpatient. Also, okay, if you're in let me see if I don't blow this, Leslie, right? So if you're in a religious, non-medical healthcare institution, otherwise known as a RINKI, which is Arden Wood, correct?
Correct.
Good, okay. I've been practicing, so I wanted to know that for sure. So the Part A, skilled nursing. So, and again, Leslie's better able to explain how that works. I can tell you how it works in a non-RINKI skill that's for skilled care only under Part A. It's for a limited time, and it doesn't cover you for custodial type care. So if people need help with eating, bathing, dressing, things like that, that is custodial care. And Medicare says, listen, we don't cover that, okay? You pay for that. So that is non-skilled care. That is not covered by Medicare and not covered under Part A. I don't know if you want to go on.
Jim, I'm going to jump in here because as a RINKI, a religious non-medical healthcare institution, we are kind of a combination of the hospitalization and the skilled nursing facility. So we will determine if an individual, it's not enough that you are 65, but you would need to require skilled care. So an individual that might be going to a hospital otherwise for care, if they were to come here and had skilled care needs, we would care for them. Medicare is not designed as a long-term care plan. So it is designed for treatment, healing, and then move along. So it is not going to continue covering. There are times that there are care needs that do go on longer, and that's where a supplemental insurance will come in. But what I wanted to share is that Arden Wood is a Part A provider, as are the Christian Science facilities that do participate in Medicare. It's only Part A coverage that applies. And that is, as Jim said, the room and board and nursing. It does not cover the Christian Science practitioner. That is separate. Yeah, that's probably enough for now. And then I'll hop in a little more on Part B when we get to that.
Okay, thanks, Leslie. Part A also covers hospice, end of life care, home health care. So if somebody comes out of, I'm talking again, non-Christian Science, if they come out of the hospital and they need home health care, that can also be covered under Part A. So how much does Part A cost? This is my big pet peeve because they keep saying it's premium free, people. It doesn't cost you a dime. Well, listen, it doesn't cost you anything after when you go on to Medicare, but trust me, when you're working, there's nothing free about it. Every time you get a paycheck, right, they take out a little bit, usually about 1.45% right now they take out of your paycheck. And if you really want to see how much free cost you, you simply look at your Social Security statement, right, that you get, and you look on the right side of that statement under hospital insurance. They don't say Part A, but under hospital insurance. And that big number there, that's how much free has cost you. So there's nothing free about it.
So you've already invested in it.
Yeah, exactly, Leslie, right? You're already invested in it. So you might as well take advantage of it. So Part B is the medical side to Medicare. And that's the, again, in the non-Christian Science, that's the medical services, supplies, lab work, x-rays, MRIs, CAT scans, anything that's a medically necessary service of a doctor is covered under Medicare. Whether you see them in a doctor's office, clinic, urgent care, nursing home, it doesn't matter. It's all covered under Part B. So you can just have Part B, and Part B is not free. I'll show you the premium this year. Well, I'll show you that in a minute. I've got it here, but Part B is not free. This year, most people are going to pay $148.50. So it went up a little bit from last year. Most of you that are receiving Social Security, that money's automatically taken out of your Social Security payment deposit every month. So if I just had original Medicare Parts A and B, you go, why would I get insurance? Why do I need any kind of supplemental insurance? And I'm going to explain here why. Well, right now, if I just have Part B and A and B, and I go see outside, I'm trying to think of a good example, Leslie, if I broke a bone or something, right, and I have to go have the bone set, or I'm in an orthopedic surgeon's office, is that a good example, Leslie?
That is a good example. I was actually going to add that if, why would a Christian Scientist want Part B? Because none of us ever intend to go to a hospital, but sometimes a situation might be where there's a need, a decision is made to have x-rays, could be a car accident, could be a number of situations, 911 is called, and you find yourself in a hospital. It's tremendously expensive. And this Part B takes care of all the physician's expenses, the x-ray, ambulance, emergency room visits, all that is covered by this. So that is why. And then Jim will tell you it's also required if you're going to be getting additional insurance.
That's exactly right. You've got to have Part A and B if you want some type of supplemental coverage on here. But in this example, we know that if you have Part B right now, and you would have to pay the Part B deductible this year in 2021 is $203, which is not a big deal. Let me tell you, if you end up going to see the doctor one time, you've pretty much hit that $203. So once you pierce that $203, you're then on the hook for 20%. Medicare will pay 80 and you've got to pay 20%. Well, what if you're in an orthopedic surgeon's office or your outpatient surgery in a hospital getting your bone fixed or whatever you broke, or a knee, however it works, you're going to pay 20% of that bill. You don't want to pay 20% because I've seen some of these outrageous numbers that you can pay even for outpatient surgery, right? When I had cartilage cut out of my knee, actually, 8 hours, it was a $64,000 bill. And I went through everything. I was just shocked for 8 hours outpatient, which is covered under Part B. Well, you don't want to pay 20% of that or whatever the Medicare negotiated rate is. Let's say they give you a deal and it's only $40,000. Well, if you got to pay 20% of $40,000, that's a big number. So that's why most people go to some type of insurance. What's even worse is there's no cap. So you have no protection, right? There's no out-of-pocket maximum. A lot of plans, when you're under 65, every single plan has an out-of-pocket maximum. So you know that if I never pay more than $6,000 or $7,000 per calendar year, that's it. But for original Medicare, you have to be careful because there is no out-of-pocket maximum, just so you understand that. So how much does Part B cost? This year, like I said, most people, 94% of the population is paying $148.50. But the government started a few years ago means testing it, meaning they're looking at your income, certain types of your modified adjusted gross income, and they do a 2-year look back and they're saying, gee, if you're a higher earner, you're going to pay more for your Part B premium. They call it an IRMA, an income related monthly adjustment amount, not Aunt Irma. Aunt Irma is cool. This IRMA is not. That's a bad thing. So the more you make, the more they're going to charge you. Next, we're going to talk about, oh, that's the penalty too, Leslie, we talked about. 10% for every 12-month period you should have signed up for, but you didn't. So you don't want that to happen to you. Worst case scenario, if you have A and B, you know you can go into a rinky, you know if you break a bone or anything like that, you've got Part B also. So it does give you some protection, but expensive. Option 1 for insurance. So this is what I prefer. I've been doing this 32 years. I think as we age, people like to have more options. Original Medicare with Parts A and B, Leslie, and everybody else, you can go wherever you want in the United States or its territories. You can see any medical professional, wherever you want to go, as long as they take Medicare. That's the key. So I'm going to show you these two options, why I think Medicare supplement makes the most sense. And maybe even Rogers towards the end can talk about the billing and why that's so important for example, Arden would to somebody have original Medicare versus these HMO type plans coming in here. Speaking of Medicare supplement plans, they never make it easy, right? They can't just say it's always Medicare supplement, it's Medigap plans, they go back and forth. But like Leslie said, you have to have both Parts A and B, and you're going to pay a premium to an insurance company for the policy. And these policies are guaranteed renewable. That means, because I deal with a lot of people, they worry because they think if they have all these large claims, they can be singled out and canceled. And that cannot happen. It's contractual. So you're guaranteed renewable. It doesn't have how many claims you have. They cannot take your policy away from you. In California, they have a 30-day birthday rule, which is important. So what that means, as you age, these plans have a tendency to tick up a little bit every year, that you can change your plan every year within 30 days of your birthday. Guaranteed, no waiting periods, no pre-existing conditions. So that gives people comfort to know that you don't have to stay in those particular plans. As we age, I see these plans go up starting off at $125, $140. I see people in their 80s paying $300, $350. And the insurance company, the one you're with, they're never going to tell you, gee, you know, it may be a good idea if you change companies so you're only going to pay, you know, you're going to pay less. They don't tell you that. So you have to be an advocate for yourself or have somebody care for you to show you that there are options. You're not stuck in one particular plan or one company. You do have options. These are the most popular plans out there. I love Plan F like Frank. This is a Medicare supplement plan. You can see all the boxes are checked. So wherever I go outside in a non-Christian Science community, whatever Medicare approves, I have no copays, no deductibles, no coinsurance. I just had a client that was in Stanford for 3 weeks with a new treatment down there. And the wife was so concerned, and she said, you know what, we felt so relieved. We have Plan F. We paid zero, nothing, for 3 weeks at Stanford inpatient. So it goes to show you the power of Plan F. Plan F was so good. You may say, how good was it, Jim? It was so good that the government said we're no longer issuing Plan F to people that turned 65 after January 1 of 2020. So if you were 65 prior to that, so if you're born prior, what's that, 1954 or earlier, you can still purchase Plan F. I see all the time people say you can't purchase it. You can still get it. Plan G is very similar to Plan F with one exception there. You have to pay that Part B deductible. You pay on Plan G, you pay the first $203, and outside of that, they work identical. The good news is that Plan G is normally less costly than Plan F. So you've got some kind of a spread there. So if it's low enough, if you can save $40 or $50 a month by going to Plan G, that savings of, in that example, of $500 or $600 is more than enough to offset that $203. It's helpful. So don't feel like you're always stuck in a plan. You always have rights, and you need to understand that and take advantage of them. Part D, okay, I know a lot of Christian Scientists don't take medication, which is amazing. If you only knew how many people I talk to every day that give me a list of 20 or 30 medications. I think the top one I had was 34 medications. And I'm talking to people that are incredible and healthy and taking nothing in their 80s and 90s. It's really amazing. So, you know, the power of prayer is truly amazing. So, but if you don't have Part D, that's okay. It's optional. If you haven't signed up for it, that's okay. There's no penalty. Like I think Rogers, we were talking about this earlier this week. But if you do sign up later, you would be penalized. So you have to really think about that and make sure it's what you want to do. As an insurance broker, I'm always worried about liability, right? If you don't do that, if I didn't tell you to do it, but you understand that better than I do. So you just have to decide if that's what you want. And if you do need it, you can sign up later, but you would be fined for not having it in the beginning. So again, the government doesn't do it. They use different insurance companies, and you see them all advertised on TV all the time, from Humana and SilverScript and AARP. They all have different prescription drug plans. And if you do have one, you can change every year during the open enrollment period from October 15th through December 7th, okay? So next we're gonna talk about the next kind of insurance that some of you have, and believe it or not, you were sold this. I don't think you bought this intentionally. I think you were sold this. It's
And
those
some of you may
Part C
have it and
plans.
not know you have it.
That's exactly, say that again, Leslie, that's exactly right.
Many of you have a Medicare Advantage plan and don't realize you're no longer in original Medicare. So Jim will explain the difference.
That's exactly right. Here's how you can tell. If you're paying, if you're paying very little, you're paying $0 or $20, $30 a month, chances are you have a Medicare Advantage plan, a Part C plan, just like the ones they showed during the open enrollment period, all the commercials where you can get it, or they have Joe Namath saying you can actually, they're going to pay you. I haven't figured that one out yet, how they're paying you, but maybe that's coming. But if you're paying very little, you have this Part C plan. And I'm going to show you how it works here, because that's super important. And believe it or not, some of you I've talked to, Part C also includes Part D, the prescription drug plan. It's all built in. Even though you don't want it, it's built into it. And some of you aren't aware of that. So let me show you how simple it's easiest to sell to you. So it's a great plan, right? It's an HMO. You've got local doctors, hospitals. Again, you've got to have both parts A and B of Medicare. And you know what I get all the time? I get, how can you buy a plan for $0? Have you ever tried to sell $0 to somebody? It's like, it's almost impossible unless you understand it. Well, if I go onto one of those HMO type plans, okay, and I'm paying $0 a month, that means the government's actually paying the insurance company. They're giving them money behind the scenes. I still have Medicare, but I'm going to receive all my services through that particular HMO, right? So it means I can only go to certain doctors and certain hospitals. It's very restrictive. But the government behind the scenes is paying the insurance company enough money where they can charge $0 or very little and add other benefits in. I'm going to show you, right, people right there. It's easy and low cost. They make it so easy to buy because there's no premiums and you should have it. It's better than not having anything at all. And people do that all the time. Again, most of the plans have Part D built in. And you can change your plans every year. I kind of went through that. But what I want to get to is that the HMOs all work like this, where you have a primary care physician and they refer you out to different, whether it's an orthopedic surgeon or neurologist or whatever it is within your medical group. So you can't go wherever you want. You may not even be able to go, I don't know, Roger's going to maybe address that in the Q&A about how it works with Rinkies in particular. But I know one thing, see this big R? They don't tell you how restrictive it is, because it's easy to get in right now. So some of you have this that I've talked to. And again, you were sold the fact that, well, it's going to take care of you if something happens, which is true, but they don't tell you how restrictive it is, right? So now let's look at original Medicare versus Medicare Advantage, why it's so important for me. With original Medicare, you can go anywhere in the United States or its territories. Any facility, that doctor, hospital, whatever it is, it takes original Medicare, you simply can pick up the phone and go. That little red, white, and blue card is your ticket into a doctor or facility. And I think, John, as an introduction, I didn't realize that there's, I believe, 10 Rinkies nationwide, Leslie?
Yes.
Yeah, that's a big deal. That's why it's so important to have both Part A and B. When you go to an HMO type plan, here's what it does. It restricts you where you can go. So again, I like the idea of being able to go wherever I want to go with no one telling me I can only see a certain group of physicians or one or two particular hospitals. I don't like that. I want total freedom of choice. We're going to talk about, Leslie, and I think you should hop in here too, maybe, about what's the best option and why it's the best option for Christian Scientists, right?
Yeah, I would love to share a little more about the challenges of working with the Medicare Advantage plans. They sometimes feel like a disadvantage for a Christian Scientist.
Right.
It requires getting authorization. And because Rinkies are not in network, most Rinkies are not in network with any of the HMOs, they immediately just will deny the claim. So it's trying to find the language, even if one can get the authorization. So the deal is, the law says that HMOs must provide all the services that original Medicare does. And original Medicare does cover services in a Rinky. But we don't quite speak the same language with the HMOs. They haven't quite figured that out yet. So it has been very difficult getting approval for coverage. It has been very difficult for someone to, because the determination is being made by the medical personnel through the Medicare Advantage plan. Whereas if someone is here under original Medicare, the Christian Science nurses are the ones that are determining that this is indeed a skilled care need. Without any kind of a diagnosis or special code, we can make that determination based on our assessment. But through an HMO, we have to present evidence where they're determining that this is medically necessary. So it just gets very tricky, and then having them actually reimburse us as they are supposed to do has been very challenging.
Very good. And if you just have original Medicare and you don't have any type of supplement, then you're subject to these co-pays and deductibles, right, Leslie, with Medicare?
Right. And I will say that because Rinkies really are only a Part A provider, there are a number of Christian Scientists that have chosen not to participate in B, and they may never need Part B. They may just come here, use Part A, and that would be fine. It's just if there's an extended need where they really are getting into a longer period of time, in particular, where that would be really helpful to have the copay coverage through Medicare supplement.
And that's where I come in, because I think it's important for people, Christian Scientists and non-Christian Scientists, to understand that you do have options aside from original Medicare. And that's where most people I talk to have a Medicare supplement, which I personally prefer. I think that makes it easier on everyone, freedom of choice. You have a Rinky, and if you have the right plan, for example, we talked about Plan F, all of these copays disappear, right? If you have A and B and you're in the religious non-medical healthcare institute, then you're covered and you would have zero copays. Let's see, the last two things, the Medicare enrollment periods, and we're going to focus on the one on the right here in a minute. We passed the open enrollment period, the annual election period, which is every October 15th through December 7th. And again, you never have to remember that, because they bombard you with TV ads. If you still read the newspaper, they're in the newspaper, they're in the radio, they're everywhere every time. They actually have infomercials on Humana and I think Aetna. They have actually infomercials on TV all day, so that if you miss a commercial, you can sit there for another half hour and watch an infomercial on that. But here's what we're in right now. We're in what's called the Medicare Advantage open enrollment period. All that means is if you have, and it's from January 1st to March 31st, that means if you have one of those HMO plans out there, that you can actually disenroll from that and go back to original Medicare Parts A and B. They allow you to make a one-time change. You can switch and go back to original Medicare with or without Part D. That's totally up to you. I just have to make sure that you understand that. Excuse me. The hardest thing in the non-Christian Science world is that I deal with a lot of people that aren't like you. It's not as healthy at all. So a lot of them, if you leave your Medicare Advantage plan and you go back to original Medicare and you actually want to purchase a Medicare supplement plan, well, guess what? The insurance companies don't have to take you. Their pre-existing conditions are alive and well in the Medicare world, meaning that if I've got something wrong with me and I want to leave my Medicare Advantage plan and go to original Medicare, I can do that. But to get the supplement, I now must answer health questions. There are not a lot of them, but people that have a pre-existing condition may not qualify for the plan. So guess what? Right now in California, there's a special offer out there with Blue Shield of California that says, listen, if you drop, and this is why it was so important, I wanted to come on here and at least show you these options, that you can actually drop your Medicare Advantage plan, that HMO type plan, through March 31st right now and go back on to original Medicare, Parts A and B. You can do that. And Blue Shield says that you can also, they will give you a guaranteed issue into a Medicare supplement, no health questions asked. That's a big deal right now because every other insurance company out there is asking you the health questions. Again, if you answer yes to any of the health questions, you cannot get their plan. So that is a big deal. It shows that if you have that HMO, what would happen too, if you leave that coverage, you're also going to lose your Part D plan. So you have to decide if that's in your best interest. Because some of you I've talked to said you purchased that, but you didn't understand that it came with a Part D plan. So that's important. The open enrollment period actually goes, and you can see there from April through April 1, you can still get a Medicare supplement plan, but you must answer the health questions to see if you can get it. So it's no longer a guaranteed issue. That is a big, big deal in the non-Christian Science world. And I know, again, Christian Scientists, you're the healthiest population I have ever dealt with in my life, which is awesome. But I just want you to understand that if you did have some type of a condition where you answered yes to, like, the big questions are like, have you been hospitalized, which would include a Rinky, right? Leslie, if you were in a Rinky in the last 2 years, you would not be able to get a Medicare supplement plan, things like that. So it's important that you understand your options. Some things not covered by original Medicare, which are really important to understand, because everybody asks me every single time, what about vision, dental, hearing, things like that? Original Medicare does not cover that, and they do not cover long-term care. And I know I'm not going to go into details on that because we're going to talk about that hopefully in March. But there are ways to protect your family and your assets, things like that. So again, this is just me talking about healthcare is focused on getting you healthy, and long-term care is really about caring, not curing, as we've seen. And custodial care is not covered because adult children call me every day and want to know what to do with mom and dad and how come Medicare is not paying for their needs. So that's why. This is a really good slide here because it's really simple. If you need any help, you can call me, you can email me. I'm going to try and help as many of you as I can, especially in California. So I know I've fielded several, I don't know, hundreds of calls in the last couple months from people asking me some of these basic questions. So I know that was kind of quick today, but I thought we could save more time maybe for questions and answers. And I know we've got Rogers and Leslie who are way smarter than I am here too. So maybe we can help you with questions and answers today.
Jim, there's a couple other points I wanted to cover. One thing is that often people mix up Medicare and Medicaid, or in this state, it's called Medi-Cal. They are two completely different programs. So Medi-Cal is based on a financial need, whereas Medicare is the hospitalization for those over 65 or some disabilities. So Arden would, and actually I don't believe that Broadview or Sunland Home, either one of them are are Medi-Cal providers. So I don't believe any of the California facilities are, but Medicare, yes. But for other options for funding, some of you might have SCS, Serving Christian Scientists insurance policies. They're not issuing them anymore, but if you have them, hang on to them. They can be useful. They definitely do pay in a Christian Science facility. Also wanted to mention the National Fund for Christian Science Nursing, a very generous fund available to support for Christian Science nursing care, whether in a facility or in a home. And it is administered through the Principal Foundation. And that is just a wonderful resource. It can be used to supplement, let's say if you only had Part A, it could be useful for some, to help with the deductibles, for example. If you didn't have a Medicare supplemental plan, it could help with some private duty Christian Science nursing, or even the visiting Christian Science nursing. The Principal Foundation also can help with the cost of practitioner bills. So that's something, it's really important to have that spiritual support, and they want to ensure that practitioners are paid as well. There are some Christian Science associations and branch churches also can help with some funding. Some facilities can also give some benevolence. Anyway, that's just other funding options, lots of resources.
Very good. How are we with the questions and answers? Do we have any today?
We do. Thank you, Jim.
Surprise.
Thank you, Leslie and Jim, for this helpful information on this unique opportunity to switch your Medicare and qualify for supplemental insurance here in California. As we noted, Ardenwood is happy to serve as an ongoing resource in understanding Medicare. Please don't hesitate to call with questions at any time. We're here to help. Now let's answer some of your questions. First one here is, I was told there was a penalty for 2 years I've been on Medicare if I did not sign up for a prescription drug plan at the time I signed up for Medicare. Can you offer any insights into this? This seems wrong if we don't use it.
Right. If you didn't sign up for it, right, there would be a penalty only if you do sign up for it in the future, right? If you haven't signed up for it, they're not going to fine you until you do. So if you never sign up for Part D, then there's going to be no penalty. But I think I used that example before. So let's say I go out 10 years, which is 120 months. They're going to say, if I did sign up at that time frame, they're going to go back and say for those, on this example, I think it was 24 months times whatever, 33 cents a month. It would be added on every single month for the rest of your life if and when you do sign up for Part D. Did I say that right, Leslie? Did that come out right?
Yeah, that sounds right. But basically, it is optional.
It is optional, correct. But if you do sign up for it and you haven't, you will be fined.
Mm-hmm.
Okay. Second question. I am 90 with no Medicare Part B, which is now too costly for me. Will any private insurer cover me? I am entering a senior facility with my sister and they want some insurance.
Oh boy. In other words, to get some type of like a Medicare supplement or Medicare Advantage, you've got to have Part B also, normally A and B, to purchase the insurance side. And you're right, that fine would be pretty costly because it is 10% for every 12-month period that you should have signed up and didn't. And if you're 90, you've got quite a few of those, so that would be costly. But Leslie, would she have options? You mentioned they did that fund. Would that work for someone like this?
It certainly could be available. It's not like it is an insurance policy, but it is a resource that she could apply for.
Okay. Right. We're just trying to look at options, right?
Yeah.
However we can help somebody, that may be an option aside from the insurance.
I mean, technically Medicare A is insurance.
Right. It is. Yes. Yeah. Right.
Okay, number 3, thank you. I just changed to Aetna, mainly for the dental care. I'm a veteran and VA is my doctor, so I really don't use Medicare. I do have Medicare, but only to stabilize me if I'm in an accident and can't get to a VA facility. Also,
Okay.
I'm a Christian Scientist. One last thing, I signed up for Medicare originally in 2015 when I turned 65, so as not to get a penalty. So am I in the correct plan?
Right, yeah. So a lot of VAs, for veterans, they recommend signing up for Part A and B of Medicare. That way, if the VA facility can't help you and you go outside of the VA community, you're covered by original Medicare. Whether you need insurance or not, I do have a lot of VA veterans that do want to get some type of supplemental coverage in case they go outside the veteran's home. So that's what I see, but most people do have A and B, which means you're covered in the VA, and if you go outside of the VA, you would have original Medicare.
I know, Leslie, we take TRICARE as well.
TRICARE for life, yes.
TRICARE for life, which is sometimes included in for the military.
That's right.
But okay, I know we have done that here at Ardenwood. Is an ambulance to Ardenwood or DME there covered by Part B?
It can be. The ambulance needs, not an ambulance coming from home, but if it's an ambulance transferring from a hospital, it can be. It needs to be billed through a physician.
And we could, if someone had that question, we could help them with that.
Right.
To navigate
We
this.
also, because some people do arrive by ambulance to Ardenwood, we usually help set them up with a transport service that's not all the bells and whistles,
Right.
and yeah, to get them safely here.
Great. Next question. If possible, please show again the IRMAA chart. I'm comparing it to the IRMAA table in my Social Security November letter.
Ooh.
Is that possible, Eddie? I don't know if we can do that.
Irma.
Oh, you mean the Part A co-pays? Is that what they're
IRMA
referring
chart, I guess. Right. Please show
to? So
again
that
the
just
IRMA.
shows the
IRMA
co-pay,
chart.
right? If you don't have a supplemental coverage, is that what they're talking about, Rogers? I think.
You might be muted, Rogers. Can't hear you.
Yeah.
Is that any better?
Yes.
Perfect.
Yes. Yeah.
Okay. And yeah, it might be it sounds like the IRMA penalty is what they're referring to.
Oh, is
Yes.
that what they're talking about?
Yes.
That would be on the Part B.
I apologize. Yeah, I was thinking the RINC. I got excited. I heard some acronym RINC. I was all excited. I think it is the IRMA, correct. So to address the IRMA, I think you have that, or I can send it. You can put it maybe on your site. It's a simple chart for the IRMA. Again, they do a 2-year look back at your modified adjusted gross income. So for 2021, they're going to be looking at your 2019 modified adjusted gross income. Modified means they take your adjusted gross income and they add into things like if you have tax-free muni bond income, foreign income, savings bonds income, things like that. That's not very common, but that would increase you and push you possibly up into a higher bracket. But I'm happy to send that to you or that you can disperse or whatever you want to do. What do you think?
Jim, is that chart the same one? Yeah. Is that chart the same one that's in the my Medicare booklet?
You know, I'm not sure if it's in there, Rogers. I made one specially, so it made it easier and larger for everybody to see. I'm not sure if it's in there, right? So if they want to, if whoever asks a question, if you want to contact me, I'd be happy to email it to you. How's that? So that way you can have it, you can look at it and call with questions.
Great. So if that questioner could then email Jim direct, that would be great. I don't have any names here in terms of who submitted these.
Okay.
Next question. If the Biden administration opens up Medicare to those 60 and older, do you know what the enrollment period would look like?
No, that'd probably be really good for business, but no, we don't yet. It's all speculation yet. But that was part of Biden's platform, was making Medicare available down to 60. So no one knows yet. I mean, it's totally unknown what they're going to do, what the cost would be. It's all speculation at this point until there's something concrete, no one knows. I'm sure they would have another special enrollment period, probably for a longer period of time for people that are still working 60 plus and that are on a group plan. Then you would simply weigh the differences in costs and say, what would be better for myself and my spouse, and for example, to stay on the group plan or go to original Medicare. I will say this about original Medicare. People all the time say, I want this free Medicare. Well, Medicare is not free, right? We know that it has a cost to it, the A side while you're working, the B side is the monthly premiums. But you know, there's also co-pays, co-insurance, and deductibles. So people need to understand, and if this does happen, then you just have to reassess everything and see what's going to be best for you and your family.
Exactly right. Next question. I have original Medicare A and B and supplemental insurance, but would like to upgrade to Plan F. Can I upgrade now?
The answer is yes, you can try to upgrade. It depends on the insurance carrier, but most carriers will allow you to apply every month throughout the year. It's not guaranteed issue, but we can certainly talk about that. You'd have to email me and see what we can work out, but you can. And remember, you can only purchase Plan F if you were 65 prior to January 1 of 2020. That's the regulations, the new regulations.
Great. Boy, we really do need your help to navigate this stuff.
It's not easy. I'm waiting to get stumped. I feel like there's a reward if I get stumped.
I'm going to combine these two questions. How much is a supplemental plan, and what does the supplemental plan cover?
That's a good question. So the premiums vary. For example, the most popular one out there is the AARP United Health Care plan, and it's all zip code rated. So for example, in my area in Placer County, it's the most inexpensive area in the state. And believe it or not, San Francisco area, as well as Sacramento, is in a very low cost area. So it really depends. If you're in San Diego or Los Angeles, the rates are all different. And it's all based on your age. So if you're 65, it's going to be less costly than if you are 75 living in Los Angeles. That's just the way it is with most all the insurance carriers. John, I apologize. What was the second part to that question? Was it the?
What's the coverage?
Oh, so the coverage would be, for example, Plan F is so simple and easy. Whatever Medicare approves under Part A or Part B, the plan pays 100% of whatever Medicare approves. So there's no co-pays, no deductibles, no co-insurance, period. The same with Part B. Right? So the supplemental plan would cover both sides. That's why F is the best plan I've ever used, because clients, it just makes life easy. If you like easy, that's easy.
And that's even beyond the 90 days of Medicare and the lifetime insurance.
Correct.
So it could even be, I've seen some of those policies go for a year, even if the individual continued to require skilled care.
That's right, Leslie. Yeah.
Next question. Are all supplements regulated as to how much they can increase their premiums each year?
No. They're not.
In a word, no.
No, but so that's part of my job is you want to look out there and you look at these insurance companies and see who's been around for a long time, claims payability. You want to look at their ratings, but it's really important. And I'm not sitting here as a broker consultant. I get paid behind the scenes, right? If I help people, they pay me all about the same. So I have no incentive to tell you to go to company ABC or XYZ. But some of these big companies do an incredible job, and they have very low rate increases because they have large numbers on the books of really healthy population. Companies that are new to the marketplace and that haven't been around or have smaller, they call them books of business, right, of the Medicare population, they scare me because if you have a lot of claims, they're going to have to increase the premiums. So that scares me. So you really have to be a good consumer and ask your agent, broker, or whoever you're dealing with to make sure that you've got one that you're satisfied with, not just some you haven't heard of it. If you haven't heard of it, doesn't mean it's bad, but mainly the big brand name ones out there right now are pretty hard to beat.
That's really helpful. I have Blue Cross Blue Shield in a PPO. Is it different from an HMO? Is it different from HMO coverage? I'm turning 65 later this year and have a plan at my work.
Yes, PPO is a preferred provider organization. It's different than an HMO. So PPO gives you more options, right? You don't have to go to a gatekeeper. An HMO is a health maintenance organization, and you normally have to do everything through your primary care provider, and they refer you out within the medical group. We had that one slide that shows you in an HMO, you must stay, that doctor is going to refer you to your neurologist, your whoever it is, your specialist. And a PPO, it gives you more options where you can just simply call the provider, right, and say, I've got company ABC, and they take the PPO and you can go. But that's different because when you go onto Medicare and you have a PPO, that's a Medicare Advantage plan, just so you know that. Even though it still has initials, when you go to Medicare, it changes. Original Medicare, to contrast that, original Medicare A and B means you can go to any doctor, hospital, provider throughout the United States. So original Medicare gives you more options than a PPO. A PPO gives you more options than an HMO. How's that?
Good.
That's why we have these seminars. It's alphabet soup.
It is alphabet soup.
And following this question ties right in. I'm confused about plan F and G. Please explain more. Thanks.
Okay. So, so plan F and G are very similar. I could pull a slide up, but I mess that up. So the difference between plan F, as in Frank, and plan G, as in George, is on the part B side, the doctor side, which a lot of Christian Scientists you don't have to worry about. But the only difference is there's a deductible. The plan G has a deductible. This year it's $203. Medicare sets that every year. Last year was $198. This year it's $203. Next year it'll probably be higher. So with plan G, that's not covered. You have to pay that out of pocket. If I have plan F, I don't pay for it. It's fully covered. There is no deductible. So what you have to do is you have to look at the difference in premiums. For example, let's say plan F costs $150 and plan G costs $120. Well, if you save $30 a month by going to plan G, that's $360 a year. Out of the $360, you would only have to pay the first $203, so you're ahead, right? It's just simple math. But what they don't tell you is that that number, that deductible, is going to increase every year. So sooner or later, that's the scary part with G, it's unknown. It can keep going up. There's no cap on that, if that makes sense.
Very helpful. This next questioner asks, will you share a copy of the slide deck to participants? They would be a good resource.
Sure, I think, Leslie, aren't we making that available, I believe?
That's an Amy question. I think we can.
Oh, or Amy, I think Amy or Roger. I think we are, yes, I think we are, John. We're gonna make it available to them.
I think when we were practicing, I think we did say yes. Great.
Okay.
Thank you.
So the answer is yes.
Thank you, Jim. Next question. You mentioned plan F under supplemental coverage. What about an innovative F plan? This is what was recommended to me. I retired in October and have signed up for Medicare Part A and B.
Mm-hmm. Right. So that's when you talk about innovative plan G or plan F, that's a brand, that's one of the insurance carriers. They all have different names where they're going to give you some perhaps extra benefits. Innovative may say we're giving you some vision and hearing benefit. Extra may say we're giving you some vision, dental, and some gym membership. So they're just different names. When you said innovative, that's one particular insurance carrier that offers those. So instead of regular plan G, they may have plan G extra, innovative plan G, or F, or vice versa. So you just have to look at the pricing and determine what's going to be best for you, not for the broker or the insurance company.
Excellent. Next question. Do you have to get a medical exam to sign up for Medicare supplement plans if you have Part A and B, but are not enrolled in a Medicare Advantage plan at this time?
No. No. So Medicare Advantage plans, when you do it through the open enrollment period, there are no physicals required. It's guaranteed acceptance. There's no waiting periods or pre-existing conditions.
Jim,
Right.
didn't you say that many of the supplemental plans will require a health history, health screening, something? But the plan
That's Medicare supplement. That's
Right.
absolutely correct. But this was, I think John said this was Medicare Advantage, correct, John?
Yes.
Okay.
Yeah. So supplement, just and like what Leslie said, the supplemental plans right now, most of the carriers don't have to take you. You would have to answer a series of health questions, and if you answer yes to one of them, that you did have some type of treatment in the last 2 years, excuse me, they don't have to take you. That's why it was so important for you to understand there is that offer out there right now that may help you or may not. It really depends, but I just wanted to bring it to everybody's attention to show you that you can go from the Medicare Advantage right now, disenroll, and go to that particular company and get a guaranteed issue, no health exam, no anything, no health questions.
Exactly. That's why we wanted to offer this tonight and then on
Right.
Thursday night, so
Yes.
we could really make sure that people knew that that was available. Next question, and this is kind of a repeat, but how much is the supplement once again for Plan F?
It really depends on your location and your age. You can email me that, and I'm happy to send you some different quotes, but it really depends on the area of the state you live in and your age.
Great. I have original Medicare A and B. I am 85. I want to get supplemental. Can I do that anytime?
The answer is you can apply anytime, but you would have to answer the health questions. There's no guaranteed acceptance right now, but based on a lot of the Christian scientists I've talked to, I'm pretty certain that I would absolutely try. There's no reason not to try. Most of you are incredibly healthy and you'd be answering no to most of those questions. So you can try every month. It doesn't matter, but the answer is yes, you can try.
Great. Next up, if we have supplemental insurance, how do we know what, if we do have supplemental insurance, how do we know what kind it is, if it's an F or a G or whatever?
So you're going to want to look in your wallet on the ID card. It should have an F or a G on there. That's the first place you want to look. It's usually going to tell you on your ID card which one you have. If not, on the back of most of the cards that are in your wallet, you can call the 800 number and ask them, the insurance carrier. They'll tell you.
Great. How often do California Medicare laws change? My wife and I are still 2 years away from getting Medicare coverage.
That's unknown at this time. We just don't know what's happening in California with the new president coming in, what they're going to do with Medicare. So stay tuned. That's all you can do. They do change.
We've got another request for the IRMA Part B chart. Please show it again. Well, I'm going to tell that questioner, perhaps you could email Jim directly. We'll have Jim's email at the end of this. So please email him directly and he'll send you the Part B IRMA chart.
Right. That's easy. Yeah, happy to do that.
Thank you, Jim. Next up, can you explain the SEP enrollment period and what the process would be to do this? I'm now 64 and plan to continue working for several more years. I have an insurance plan through my school that I work for.
Sure. Yeah, you're talking about the SEP as a special enrollment period. So if I'm beyond 65, I'm still actively at work. Medicare says I can come off my group plan whenever I choose. If I choose loss of group coverage or if I retire, that opens up actually it gives me 8 months to sign up for Part B of Medicare. I have an 8-month window. Most people never ever wait that long. They usually plan 3 or 4 months ahead prior to retirement. That way you can do it. You create the special enrollment period. You sign up for Part B within that 8-month period and there's no fines from the government.
Great, the questions are coming in fast and furious. Let's see, next question. Does the government let you know if you qualify for a lower payment if your income changes for Part B?
The answer is they're supposed to, because they do a 2-year look back. So for example, in 2020, they were looking at 2018, your tax return, and for 2021, they're going to look at your 2019 tax return. you can always call. So if you have a life-changing event, if you retire, if your spouse passes away, there's a change in income, you would contact Social Security Administration and ask them to say, please, they've actually got a form that you can fill in. But a lot of times they're very good about doing it over the phone. You can call Social Security at 800-772-1213. You always want to ask. All they can say is no, but you absolutely want to ask if you have some type of a life-changing event to get those IRMA, the extra tax, actually lowered. So always try.
Great question and answer. I too endorse AARP United Health Care, which I've always had. Can I get plan, well, I don't know, is that a question or a statement? I guess that's a statement. Can I get Plan F through Medicare Advantage United Health Care?
No, there's no supplemental plans have the initials, you know, G, F, things like that. Medicare Advantage, they don't have those initials. They give them some other name, whether it's AARP, Secure Horizons, Medicare Advantage plan, something like that. So that's not included. Medicare Advantage has their own benefits, co-pays, deductibles, and co-insurance.
What's confusing is that both United Healthcare has both Medicare Advantage and supplemental.
That's
So
right, Leslie.
know your policy.
That's right.
And to be fair, I guess this is all one question. It's confusing. This is the first time it's printed out like this. I'm going to read the whole thing. I too endorse AARP United Healthcare, which I've always had. Can I get Plan F, which I just mentioned? I have Blue Shield RX Plus PDP. I have SCAN, SCAN, through my City of Los Angeles retirement plan.
So you're on, so SCAN is a Medicare Advantage plan. That's a Part C plan. And the Blue Shield, that's a Part D. When they say PDP, that stands for Prescription Drug Plan. So you've already got that Medicare Advantage. So you would have to change that if you wanted to go back to original Medicare and add a supplemental plan. But again, you got to look at if that's through the, I can't remember if you said you're retiree or you have to look at the cost factor and make sure it's beneficial for you to do that before you make a change. Did that answer that? Yeah.
Well, I think she might, this is kind of complicated. I think she might want to be in direct contact with you.
Okay.
Or he
give
or she,
this question to
excuse me.
Rogers then. Okay.
Thanks.
Thanks, friend. Yeah. My plan from Anthem Blue Cross says it's Medicare Plan F with high deductible. Please explain about high deductibles.
Sure. So some of the companies out there do have high deductibles. They're not currently marketing, except I think for United American is marketing. So you would have Plan F, which is exactly like Plan F, except you would pay the first portion of the deductible, whether it's, let's say it's $2,000. Once you paid that $2,000, Plan F would cover you at 100%. The deductibles usually change every year. So they also have some of the insurance carriers have high deductible Plan G or Plan F. So once you pay that deductible, you hit that deductible, normally you've got coverage in full.
Great. Just a few more questions here. If I signed up for supplemental, will it show on my Medicare card? I signed up last year and think I have supplemental, but I don't remember right now. My card shows Part A and Part B. It's through Kaiser.
Oh, okay. So if you have a Kaiser card, that means you're on a Medicare Advantage, an HMO type plan. So that's what that means. So, right, you don't have a supplemental, you don't have original Medicare. You're getting all your care through Kaiser. Right, Leslie?
Right. And what's confusing is when you're in a Medicare Advantage, you also still have your Medicare card. So you have to look at both cards and you have to see what initials are on it and try to figure out if it's an Advantage or a supplemental. But Kaiser is definitely not a supplemental.
Right. They're not supplemental. They're one of those HMO type plans.
Right.
And Kaiser, Leslie, and Rogers has been pretty difficult for us to get paid.
We actually were the first, and as far as I know, only Christian Science facility that has ever received payment from them. And we have twice, but not without a battle, right, Rogers? So it's been challenging. We have had some wonderful successes in working with Medicare Advantages plans when you finally get to a person that will listen to you and understand and do the right thing. But many times you spend a lot of hours and sending a lot of documents and you get nowhere. It takes months sometimes to get approval and claims paid, sometimes years.
And I think that's the headline in terms of this seminar or these webinars, is that, say, for instance, we take care of a patient, or say, for instance, you're a cabinet maker, you go in and you put in someone's kitchen, and then you don't get paid for 2 years. That doesn't seem quite right. And so that's what we're trying to do here is we provide a service, we want to be paid for that service in a timely manner, if that's the way the audience can understand it. It's very difficult. As I say, when you provide, we've got a huge infrastructure here, and then you don't get paid for 1-2 years, or you have to, like with Rogers or with Lesleah, spending a tremendous amount of time going from person to person to person, navigating your way through this matrix of people at the different insurance companies. It's very challenging and frustrating. So this is why this is so important.
It is pretty much the only time that we've been paid on Advantage programs is they almost always end up in
Appeals.
not litigation, but appeals, like
Appeal
one step
process.
below litigations. And we have to go through a tremendous amount of appeals. A lot of times the individuals are involved too, because we're appealing for their behalf. They have to sign on the documents and get them sent back and forth. And so it is quite an effort.
We work with attorneys, we prepare a lot of documentation, but we're still having to appeal to the medical to get their approval that this is a need. And we're just speaking 2 different languages, where if it were original Medicare, we could easily make that determination and it would go through without a hitch.
So you can see why this is so important. And it's, when you think of a medical system that deals with tens of millions of people a day, we are such a small percentage of that. That's part of this, but still, that's why we have these seminars if you want Christian Science care, this is something you really want to know if you are eligible for Medicare. Next question. Are there physical problems like dementia needing full-time caregiver service? My mother is in this situation that I'm caring for her with caregiver service.
Where do we start
for you,
with
Lesleah,
that?
or-
I guess, I think that is one care need that typically is not considered a skilled care need and would not be coverable by Medicare. I don't know about other insurance. It's a very challenging situation.
Right. Yeah. And just so people understand, if Medicare doesn't cover anything, no supplemental plans pay. So if Medicare doesn't approve of something, no insurance pays, or supplemental insurance pays.
And it sounds like if we're talking about caregivers, perhaps in the home, Medicare doesn't
Right,
apply
yeah.
in the home.
No. But what they should do is they should look at, we talked about Medi-Cal before, they should look at other options too, and see how they can best help their mom too. There's other sources out there that they should check into.
The National Fund could help if there's a Christian Science nurse helping on the case.
Okay. Oh,
You're muted,
John,
John.
you're muted.
Thank you. Sorry, I'm trying to, so the printer doesn't sound when I'm printing these questions. Do plans F and G ask medical questions?
Only if you're not in a guaranteed issue period. If you're in a guaranteed issue period, there are no health questions at all. So if you're not, then you would have to answer the health questions for either both F and G. That's correct.
Okay. If one has plan A and B and has to pay IRMA, then supplemental plan is on top of that, correct?
That's absolutely correct, right? It has nothing to do with the government side. The government charges you the standard premium or an extra premium or an extra tax. That has nothing to do with the supplemental coverage. The supplemental coverage is the premium. There's no extra tax on the supplemental plan.
Great. I will be 64 next month. Since we went through the enrollment times quickly, should I be applying this year in anticipation of turning 65? in February of 2022, or do I wait until I actually turn 65 in 2022 to apply? What was the regular enrollment time again?
Yeah, you really want the initial enrollment period's a 7-month window. So you take 3 months prior to the month you turn 65 that month and 3 months after. But to answer your question, you would start looking at about 6 months out. You want to make sure that you understand how to enroll through Social Security. By then, maybe Social Security offices will be open. Instead of doing it online, you may want to go down there. But you always want to give yourself, at least 3 or 4 months ahead of time. And you enroll during that initial enrollment period, and then there would be no penalty.
I'm 73 and only have Medicare Part A. If I decide now to get Part B and then the supplemental plan, is there a penalty?
Yeah, there is for the Part B plan. Remember that the supplemental coverage, there are no penalties, but the government would charge you, again, 10% of the Part B premium for every 12-month period you should have had it and didn't, and you've got about 8 of those.
Great. Well, we've got 2 more questions here, and then maybe we can look forward to people joining us again on Thursday. Does Ardenwood cover all expenses if one has Plan F supplemental insurance?
Rogers?
Yeah. If we have Part A and the Plan F supplemental, yes, that should probably take care of, I don't have off the top of my head just exactly what all the different plans, but looking at Jim's check sheet that he showed there, it looked like the major things, the deductibles, the co-insurance, those were covered. It would also depend on whether the one was a high deductible that one of the other people asked about. If this one happened to have a high deductible, then there would be a deductible within. Is that the only time, Jim, that they have a deductible in those plans? Is if they have that special? Okay.
Yeah. If they have the high deductible plan, then they would have to pay that first, and then Plan F would kick in, right? You pay your deductible, then Plan F would pay 100% after that.
Yep.
Great. 2 more. I guess I'll finish up with this one. I'm so glad I asked about Kaiser. Thank you for the feedback. I will look into changing. Please tell me again when I can do that. Thank you. And then I'll close with the last question.
Yeah, you can change during this enrollment period right now between January 1st through March 31st and go either keep original Medicare or you can get a supplement. But remember, the special offer while we're doing that is that you can be guaranteed accepted into a supplemental plan if we enroll by February 28th. And that would automatically give you coverage into a supplemental plan. So if you're going to Ardenwood, then you would have original Medicare, which would make it easier on everybody, and then the supplemental plan to offset, so all those crazy copays and deductibles you would not have to deal with. So you have this time frame, you have this window right now. So if you want to change, now is the time.
Yep, and that's exactly why we're having this seminar. Okay, last question. What kind of insurance, I guess this is directed to Rogers, what kind of insurance and what companies get you paid promptly there at Ardenwood or at Broadview or at Sunland?
Well, the ones that we've had the best success with, again, is a traditional Part A Medicare, and then the supplemental. I have to say that probably the easiest one to deal with is typically the AARP supplementals. They're, they on the traditional Medicare, they seem to go through pretty well. Have a few problems every now and then, but like I say, for the most part, they go through pretty much like clockwork.
Well, that was excellent. Jim, thank you. Rogers and Leslie, thank you one and all again for joining us today. We hope you'll share the news about this webinar with family and friends who might like to attend Thursday's webinar, also at 4 p.m. We will cover the same information followed by question and answers. If you know someone who does not use a computer or a smartphone, we can mail information to them. Once again, this is a unique time-sensitive opportunity, And Jim has set this up for us. I mean, this is big kudos to Jim Maher to really listen to what the needs are in the field. So we are so grateful, Jim. So thanks to one and all.
Yes, thank you.
Thank you, Jim. So
thanks, everybody.
Everyone,
Pleasure
goodbye
dealing
for
with all
now.
of you.
Thank
Bye-bye.
you. Bye-bye.
Thank you.